One of the most fascinating facts about mitral valve prolapse is that it's often described as a drama queen of cardiology. Why? Because although most cases are completely benign, the condition can produce a wide range of symptoms that seem disproportionate to the structural abnormality itself. So mitral valve prolapse occurs when one or both leaflets of the mitral valve bulge, or prolapse actually, back into left atrium during systole. So the classic sound you will hear on auscultation is so-called mid-systolic click, often followed a late systolic murmur if mitral regurgitation persists, develops actually. The interesting part is that mitral valve prolapse affects from 2 up to 25%. No? It depends how you put the probe on of population. Essentially young women, interesting, and most of them have completely normal life expectancy. However, for a very, very, very small subset of patients, this condition can be associated with complications like mitral regurgitation 2, 3, infective endocarditis, so definitely infective endocarditis, life-threatening condition. Some types of arrhythmias. This is why understanding its clinical spectrum is crucial. Pathophysiologically, prolapse often linked to myxomatous degeneration of the mitral valve, very rare condition in human beings. On echocardiography, you'll see leaflets billowing more than 2 millimeters into the left atrium during systole. Actually interesting that mitral valve prolapse is also associated with connective tissue disorders, autoimmune pathology, such as Marfan syndrome, genetic disorder as well, and Ehlers-Danlos syndrome, which can hint an underlying systemic problem. For an exam standpoint, remember these 3 pearls. The murmur and click move earlier in systole with standing or valsalva and later with squatting. Echocardiography, gold standard for diagnosis, and most patients, absolutely most, don't need any specific treatment, just reassurance and maybe periodic follow-up and least significant regurgitation develops. So the most interesting point about prolapse is that it's the most common valvular abnormality detected in otherwise healthy people, often found incidentally during a routine checkup. Okay, so don't be scared, everything's great. God bless.